Yes, thank you. We're hearing from some First Nations leaders who are saying there's a lack of clarity about vaccine allocation since an unexpected change to the vaccine rollout plan last week. They're also seeing, they say, an inequitable distribution between communities where some appear to continue to get vaccines for the whole community, while others are being told their allocation is limited to specific age groups. Any insight into why that's happening? And if we could get an answer in front as well, please. Thank you.
You know, this has been a priority for me and for us in our immunization program from the very beginning. And we have we've worked very closely with our First Nations partners to make sure we've identified those remote and isolated, to start with, the remote and isolated communities, and take an all-of-community approach. I will say that during our period of time in January into February, where vaccine was strictly limited, where we had no supplies coming in, particularly of the Moderna, and most of the vaccine that we sent to the remote isolated, and then increasingly providing immunization as available to First Nations communities in areas all over the province. It was Moderna vaccine that we were relying on, and we had a number of weeks where we had very little Moderna vaccine, and we had to make the decision with our First Nations Health Authority partners to focus on protecting as many elders and seniors as we could in that period of limited vaccine. I can say that we've been in discussions now about how important it is now that we have delayed the second dose. That frees up a lot of vaccine that we can get back to the whole of community approach.